this is Dr. Gray. I'm going to give you guys some advice on posture. We were sending out sheets before and it wasn't working very well. So exercises that you can do, especially when you start. One of the things that happens, posture is very aggravating for all of us historically, and it was really aggravating for me up until about 3 or 4 years ago, until I started paying attention and things became clear. Typically when someone asks us to straighten up, we activate all the wrong muscles, which is the key to all of this. So when we're like this, we can't bring our head back, we can't bring our shoulders back. And then when someone says, hey, straighten up, you straighten up, but we activate all the wrong muscles. So the key actually, when we're talking about posture, the spine is designed to stand upright, to lie flat, or to squat. It's actually not designed to sit for long periods of time. So what we want to do is we want to get the bum in the right place. The bum is the key for proper posture. So we stand up, we get the bum in the proper position, immediately the shoulders fall back and the chin falls back. Very nice and easy. The way you get your bum in the right place is you try to stand this much taller with the tip of your head, and then that solves it. And now as soon as we're here, everything's firing appropriately. The glutes fire, quads fire, core fires, lats fire. These are the 4 biggest muscle groups in your body doing exactly what they're designed to do, which is hold you in your proper posture. Initially, for the first couple of months, this can be a little bit difficult to start with. It'll feel a little more taxing potentially, and you'll feel like when you get out of the car, you're going shopping, you have to haul yourself up. That's part of the process. And then the big key, when you're sitting, don't necessarily worry about your posture a whole lot. The biggest issue when we're sitting, because we're not designed to sit, you're going to collapse sooner or later. But the key is every hour to an hour and a half, get up and change the forces. And we're going to give you some exercises on how to do that now. All right, so now we want to address what can happen when we're sitting for long periods of time and when we spend decades of our life developing this. So now what has to happen is we need to let the anterior chain get longer. So the fascia that is in the body, all the connective tissue, like myofascial syndromes of the feet and throughout the body, we want all of that fascia to actually release. And then think of it as one unit that goes from the bottom of your feet to the tip of your head, crisscrosses in the middle. There's deep fascia, there's superficial fascia. What we want to do is get all of that longer so it makes it easier for you to stand upright. So we want to get the fascia through the shoulder girdle to open up and through the chest, through the diaphragm, and through the pelvic girdle to open up. Because when you stretch this, you're actually helping all of this as well. So when you arch and get backwards. So one of the best ways to do that to start with is we're going to do a doorway stretch. You go into doorway, everything, okay, you want your elbows close to your body, hands shoulder height, that minimizes risk to the shoulders. You go in like this, and then allow yourself to go forward, and once you're in, take a little step. Okay, and then you just let your shoulders open up. You can let your head go back if you like. Okay, this is fantastic. And we'll start there, and then we'll give you a couple more. Okay, now I don't have a little exercise ball in the office, so I want you to imagine that I'm on an exercise ball. If you get down low, get your pelvis low with the exercise ball, hands on your chest to start with, cross, and arch back. Very, very gently. When you're here, then you can start to open up and let everything extend as you're comfortable, and let everything open through your chest, through here, and through here as well. Okay, this is actually one of my favorites, and it's super simple, been around forever. Broom handle, stretch. Okay, so you just put the broom over your shoulders. Super, super easy. Rotate, open up, rotate, open up. Hold each one, 30 to 45 seconds is easy. Then, hands behind the back with the broom handle, pull up, okay? Open as much as you can through the chest, get as much space as you can. So you pull with so you want to take this hand, pull up very gently, get a stretch through the shoulder. Then you want to take your bottom hand, pull down very gently, okay? And you can pull down and try to get your hands closer and closer and closer together. And then you want to arch back, open this right up, and then do the other side. Okay, and then continued stretches. First thing in the morning, wonderful idea, roll onto your stomach, get your hands under your chest, and just gently push up and back because you want to start getting long. Because the first thing that we want to do is we want to set the pelvis and get it where it's supposed to be. A wonderful way to do that also, hands in the dimples, arch your chest back, and I'm gonna keep talking yet. Don't judge me for how inflexible I am, but you wanna have your hands here, arch your head back, and thrust this forward so your pelvis starts to open up. So arching back. Okay, I'm just gonna do it very easy for now. The other thing that we wanna do, we want to then open the chest, hand low. I don't like hands here for this. I really like hand lower, opening up the chest this way and back. Okay, and you can do that both sides very easily. Okay, this is one of my favorite stretches. All of the stretches you can do, ideally, you want to be doing something 4 to 8 times a day. I really like this one twice a day. So do it first thing in the morning and the end of your day, for sure. So as I was going to demonstrate, you want to get as long as you can from the fingers on one side to the toes on the other, same side. So her right hand is going way out, her other toe is going way over here. Then the other thing you can do is use your opposite hand to go into the pec, okay, and feel this, because you got a mind-body connection through the stretch. Then usually just inside the chest, right around this area, you can also check, and Zoe won't demonstrate that this time, but you can sort of feel it. Then into the diaphragm. This is one of the most critical aspects of this stretch, so it's fantastic. You'll be able to feel this open up, and especially important, we tend to get very tight through the junction between the ribs and the low back, and this is a wonderful stretch through that area to activate this. And then down into the psoas muscle, right into the hip flexor in here, you'll feel it tight right in here and through the glutes on the back. This stretch, well, most of the stretches that I recommend, 30 to 45 seconds will suffice. Even this, 30 to 45 seconds will suffice. But what I really like patients to do, concentrate on getting longer and having it last a couple of minutes. Okay? And you can do that both sides. So quickly, we're going to talk about what we need to do to strengthen the upper back. The rotator cuff, contrary to popular belief, has nothing to do with the anterior part of the shoulder capsule. It has everything to do with the posterior part. There's 3 muscles back here that we pull out this way, and 1 in your subscap. And those 4 muscles make up the rotator cuff. More than 90% of the population over 70 years old ends up with shoulder cuff issues. Main reason is with our posture, when we're like this going forward, as these come forward, these rotator cuff muscles, they get long and thin. As they get long and thin, they're going to get weak. They're going to develop micro tears. The micro tears become major tears, and then we have issues. So when we're having our posture this way, standing upright, and we have our glutes firing, quads firing, core fires, lats fire, now we want to next have our upper back stable, and we want to work these muscles appropriately. So one of the most effective ways that I've found, we're going to do 2 exercises for you. Get a resistance band. Okay, I'm just going to start out here, and then from up high you want to pull down and away, and when you hit the bottom, the last 1.5 inches you want to pull your scapula together really tight. Okay, and you want to go back up and then come down, pull really tight, and do 8 to 10 of those a couple times a week. And actually, one trainer that I saw, he's actually a gentleman in California, I believe. Anyways, he recommends every single day. So it's a personal choice for you. You can do these every day. Don't overdo it. If you start to get weaker, then you're overtraining. And then you want to do a horizontal. So from here, back, here. And always, thumbs are out. Okay, this is highly compressed. So when you do it here, you're compressing the shoulders. When you do it here, your shoulder capsule is opening. So from here, thumbs out, pull. And then again, the last 1.5 inches, pull back, really nice and tight. And then you go forward, then come back, pull. If you don't have a resistance band, you can do something called YWTLs. And I don't quite have room here to show you, but you can go on your yoga mat, go into an L, and then pull up and away. Okay? As hard as you can. So that's a Y. A W is like this. When you're here, have your elbows close to your body. Up and clench. T's are out. Thumbs up and up. And then L's are like so. Thumbs up and away. And you can hold. So
From here, you get into this position, you hold for 15 to 30 seconds, really nice and tight, really try to clench the muscles together, and then you relax.